Thank you everyone for coming for this session. I'm Kee Seng. I'm the Dean for the Saw Swee Hock School of Public Health. We're having this thought leadership series to discuss various issues that are of public health significance, in particular for Singapore. And this afternoon, my role is to just give you a bit of a background in terms of why we're choosing this topic of shifting the paradigm, integrating workplace health, protection, and health promotion. I think, as you know, in many countries, just like in Singapore, the whole area of workplace health protection and workplace health promotion are very divorced from each other, and the healthcare delivery to workers is very much fragmented, both at the government level, the management level, as well as at the worker level. So at the School of Public Health, we're suggesting that what is needed is an integration of both workplace health protection and health promotion. And I think there are three reasons why we need to move forward towards this integration. First is this whole issue of chronic disease, the epidemic of chronic disease that is coming at us, both in terms of having greater number of workers with chronic diseases, that we need to work at prevention, primary prevention of chronic diseases, starting off at the workplace. I think the second component is that we always tend to look at occupational health as how workplace exposures influence the health of the worker, but we have forgotten that actually the health of the worker also influence in terms of his work as well as in terms of accidents and occupational diseases. And I think the third component is basically because the cost of having a sick worker or a worker with chronic disease is going to be increasing, especially with a tight labor market, and we therefore need to ensure that the health of workers are further enhanced. And so the idea behind this integration of workplace health protection and health promotion is to change a mindset. That currently the mindset that we have is we work safely from 9 to 5. Perhaps we should change our mindset to we should work safely and healthily until 65. And so for this afternoon, the format of the session would be, we would have Professor Dame Carol Black sharing with us her experience in the UK. Professor Carol Black is rheumatologist by training and was very eminent in the area of scleroderma, but apart from being a clinician, she was also the expert advisor to UK Department of Health in terms of work and health. And one of her very influential report was the health of the working population in 2008. And we're indeed very privileged that she's here. While she's on holiday, she's willing to take time off to spend some time with us this evening. So she'll make a presentation, and then that'll be followed by two short responses. Firstly, by the Commissioner of Workplace Safety and Health in Singapore, Ministry of Manpower, Engineer Ho Seong Hin, followed by the Chief Executive of the Health Promotion Board, Mr. Zee Yong Kang. So without further ado, I would like to invite Dame Carol Black to make a presentation.
Well, good evening. It's a pleasure to be back. As I've said many times before, I really love coming back to Singapore. I wonder, is it possible just to lower the lights on the stage? I think would benefit some of the slides. I don't know whether I should talk to the people at the back or whether that's possible. Anyway, I'll start while we think about that. So we're going to talk about integration of health and safety with well-being promotion. I do hope you all think that is a good idea and that it would be better to have healthy workers because they'll be safer workers. But to do this, you can't do it without leadership from the top. It's got to be part of the day-to-day business. It can't be an add-on. It's no use just putting the fresh fruit out on the table if you haven't really integrated it into the business. And you have to understand that it can improve the economic performance of a company, so it improves the bottom line. And as we've just heard, we're an aging population, we're living longer, which is a good thing, but many of us are living with chronic disease, and certainly in the United Kingdom, we have almost an epidemic of obesity. We are now the 5th fattest nation in the world, which is dreadful. But in addition to all of that, there's a lot of competition, so it's important to global markets. So how do we achieve this? I'm going to this evening give you some examples, and we need to be able to do it for small companies. We need to be able to do it for medium-sized companies. We need to do it for the private sector and at home, because we have a very big public sector. We need to be able to do it there. And on the whole, the private sector at home has been better and quicker at doing this than the public sector. So I thought I'd start with the small. We found them a considerable challenge because what they want to know is, how do I do it? Where is the roadmap? What should I do next? So I think you must personalize this offer. They don't know where to start. It's no use saying, look after the health and well-being of your staff, be preventative, have promotion of health. So they need tools, they need examples, and often they need help to get going. But once you've got them going, then they can often carry on. And at home, we link them to free services, so anything that is free within the NHS, so for example, the Stop Smoking service. We also have been trying to link them to larger firms on some of our industrial estates. Celebrate Success, we have regional and national health and well-being awards, and the small companies really love those. They really like being celebrated. And then we've got something called the Responsibility Deal, which is a deal between the Department of Health and companies which promotes the health and well-being of staff. And we're trying very hard to include SMEs. Now, there have been several surveys, and this is the IOSH survey of 2012. I just thought I'd show you what SMEs think, what they say would help them in the United Kingdom. Well, they say better access to free, high-quality health and safety guidance. 2/3 of them think they'd benefit from tax breaks. So, for example, subsidised gym membership, vocational rehabilitation. We have just got the Chancellor in the last budget to agree that it's not a big amount of money, but any company can have £500 worth of vocational rehabilitation free of the tax that they would normally pay on this. So that's been a step forward for the small companies. 70% report that health and safety management is important, but most of them don't know what it costs them in sickness absence, and they certainly are not able to estimate what they might save. So we know that there are things that they want, but we know that they don't really know what it's costing them. This may not come over too clearly, but the SMEs were asked for views on 3 often quoted benefits of focus on workplace health and safety. Improving productivity, only 31% thought it would do that. Increase in retention of staff, 26%. Increase in business secured or retained, 20%. And many thought there were no benefits. Improved productivity, more often cited as a benefit than better retention of staff. However, 35% of companies did not recognise any benefit at all. So we have a long way to go in getting to our small companies to get them to understand this. Some of the things that we've done that have been useful, just 2 examples, of a multi-channeled helpline or work advice line. The numbers of calls are now going up. They're using quite a lot of social media. I think the most interesting thing so far on this multi-channel advice line, approximately 40% of all the help that is downloaded relates to mental health issues. And so we know that mental health issues, which are often difficult to talk about, are something that SMEs and medium-sized companies would like help with. And you can see there that 90% of service users are satisfied with the online knowledge base and 95% with the specialist nurse advice. These nurses have had extra training in mental health. So it's a channel which people can access. Either they can phone up or they can do it online. This is increasingly helpful. The thing I really like is this thing called the Workplace Wellbeing Charter. I think of it as a roadmap. It's a set of standards. There are 8 standards, and you can see them there. They go from leadership through to alcohol and substance misuse. They cover mental health and well-being, smoking, physical activity. And you can do one standard at a time, so you don't have to do everything together if you're a little company. And you can either commit, you can achieve, or you can be excellent. So people don't give up. It's not overwhelming, it's doable. And an award is given to organizations that achieve the charter standards. This is voluntary, and the employer can use it to assess their approach to workplace well-being, or they can go on to the proper full assessment and get an award. Now, the Department of Health is interested, and most recently, Public Health England, which is a new arm's length body, but funded by the government, has decided to support a refreshing of the Charter and to develop national standards. And it's being led by Liverpool City Council in the north of England, which is where the Charter originally came from. So it will be national. We'll have national core standards. We'll have national branding, so you can get a branding which you can put on your company note paper or in your company office, and there'll be an accreditation model. So they're just 2 examples of what we've found that small companies think to be useful. If we move to the larger companies, this is an example. This is Novartis, of course a global company, and they've been doing this for some 10 years. But more recently, they've got an enlarged program. They call it Move, Choose, Know and Manage. So they want people to be more physically active. They've made it possible that the healthy meals in their restaurants are cheaper than the unhealthy meals, which is always good. And whether you're on site or whether you're working off site, they make it that is always the cheapest option. And clear food labeling. They like you to know your numbers. There's additional screening, and again, smoking ban and cessation programs. And they have a lot of help for mental health promotion, so positive mental health. And they do it differently around the world because they are a global company. I think one of the important messages is whatever you do, it must be suitable for Singapore, and that will be different from other parts of the world. So in Switzerland, they really wanted to concentrate on knowing their numbers. In the USA, quite a lot of emphasis on physical activity. You can see there in Slovenia, a cooking competition, and in China, healthy breakfasts distributed in the office. They're in more than 50 countries. One of the things they did will be something you may have heard of, a thing called the Global Corporate Challenge. It was founded over 10 years ago. Many, many companies sign up to it. It's a part of a worldwide movement. You form a team of 7. It's a 7-person team, and you have your pedometer, and your team walks around the world. There's quite a lot of competitive spirit about this, And you can see that 9,300 Novartis employees participated last year. So it is a way of getting people to up their physical exercise, but do it and have some fun. And the results are pretty good. You can see there before and after about reporting good health. This, of course, is self-reporting with all the caveats of that. 30 minutes of planned physical exercise 4 or more times a week went up considerably from 29% to 59%. And people reported a positive impact on their relationship with exercise. 59% reported losing weight. So this is one way. There are many ways, but this was just one of the things that worked for Novartis. I thought that British Telecom was another good example because they've moved a long way with mental health, and they're now talking about organizational health. And they say you must pay attention to personal, physical, and psychological health, and you must link that to organizational integrity and to leadership, which were some of the things I mentioned at the beginning. If you do that, they say you will get a sustainable business performance. In order to do this, they looked at the need assessment. They really worked with their employees. They've had quite a lot of flexibility and choice in the interventions. They've evaluated it. They've tried very hard to improve quality and sustainability. And rather than address mental health head-on, they've done it in the context of general health, which I think is a very good idea. They want to raise awareness. They want to focus on small but sustainable changes. And they really want to work in partnership. And again, they've had some pretty good results. So cardiovascular results, an average weight loss of 2 kilograms, 30% success rate with stopping smoking, much better knowledge about cancer and how to be aware of the signs, again doing quite a lot of work on diabetes and also on mental health. You can see the quote there. I hope that not many of us need to lose 40 pounds, but he said he had another 20 pounds to go, but he must have been really overweight. But again, it's this business of people working together to do good things that will improve their performance at work. And this is something, the Heart Age tool, which the National Health Service at home is using. You can estimate your heart age. It's a simple online tool. You can see whether your heart is older than you really are, or is it younger than you really are, or is it the right age for you. And recently they've also been using it at Unilever. I think this is really an important message in this slide. This is data from the Unilever sites, and if you look at the marketing site, you can see they're much healthier. So this is not anything this side would be good, anything this side is obviously you are older than your heart age. So the factory sites where there will be poorer employees, they will be doing much more physical work. They will be living in poorer economic situations than those who are in the marketing site. You can see that they had a poorer heart age. So I think when you think of programs you want to introduce, you must introduce it for those who are at the bottom of the pile, as well as those who are in much better socio-economic situations. I couldn't resist but tell you a little bit about the health service, because the public sector at home is often criticised for not doing things well. Well, we have a lot of improvement to go. We employ about 1.4 million people, but you can see the cost of sickness absence is 1.7 billion per year. And when Steve Borman did his review of the health of the NHS staff, he suggested that 1/3 reduction would save a great deal. It would save 3.4 million days a year, and it would allow us to have many more full-time equivalent staff at work. So the thing that's been happening in the NHS, and this has been based on the Department of Health providing the resource and providing the manpower to develop these 5 high-impact factors. Again, it talks about leadership, managerial capability, having a plan so that each hospital will have a plan, better occupational health services, and encouraging people to take much better care of themselves. I've just picked 2 of those just to show you a little bit more about what's going on. So having your line managers trained. Line managers know their staff better than anyone else. So the best hospitals at home are training their managers, enabling and supporting them so that they can build resilience in their staff. They recognize the signs of stress, and they have proper appraisals in which they also address health needs. And this is an example from the north of England. It's the South West Yorkshire Partnership Hospital. We call them trusts, and I'm not sure why, but we've stopped calling them hospitals. But there you can see, by concentrating on manager training and a learning program, they achieved big reductions in working of long hours, they reduced bullying and harassment, and increased engagement. You can't really allow managers to choose whether they have training, because if you look at this slide, although many hospitals, you can see their training for line managers, 63% had training, but only 19% was it taken up. So when it's voluntary, then the managers choose to do other things. They don't get properly trained. And so I think if you want it to really work, and I fear it's got to be mandatory. And you can see there training on understanding when to refer to occupational health. Again, non-mandatory training and a much lower percentage. So things are happening in the health service. And what about the staff taking more responsibility, doing things for themselves? And this is the example from the Walton Centre, a neurosurgical and neurological centre in the north of England. It's called Work Well. They focused on the key issues that the staff wanted to focus on, and they put in some resources, and they've almost halved their sickness absence rate from 7% to 4% in 18 months. And they've been helped by the NHS Sports and Physical Activity Challenge, which is a bit like the global challenge that Novartis engaged in. We have, I think, about 386 hospitals in the NHS. 220 took part in these challenges. They increased the level of physical activity. It was setting examples to patients, and it reduced sickness absence. And in Somerset, which is in the west of England, several hospitals combined together, and they've noted a very good increase in activity, weight loss, and reduced sickness absence. So I think just wanted to bring you some examples. I think you have to show people where's the roadmap, how do I do it? And just to assure you that being healthy does improve safety, I've taken 3 examples. If you've got a sense of well-being and you're healthy, you will be more engaged at work. We know that from all the research. Organizations with engagement in the bottom quartile average 62% more accidents than those at the top. So health and well-being equals less accidents. When we built the Olympic Park, there were no deaths. It's the first time in the modern Olympics that there wasn't a death in building that village. And there you can see that the strategies to improve employee engagement had an excellent result. And perhaps most telling of all, in our hospitals, where you have low engagement, then the mortality rate is higher. So if you're going to go into a hospital in England, you should look at the engagement level of the staff before you go into that hospital. And if it's low, you shouldn't go. And if it's high, well, you've got a fairly good chance. So I just wanted to make the real point that this is not soft and fluffy. This is quite serious. And I'll end, because I do think it's relevant and probably helpful to Singapore. I've been doing a lot of work in the last 2 years with the construction industry. We have a lot of migrant workers. They come from Eastern Europe, most of them, and 1.2 million people work in construction, 6% of our entire workforce. It's itinerant, it's male-dominated. These workers are hard to reach. But the companies, our construction companies, have now decided that if they look after the workers, if they help them, if they promote their health, if they try to help them deal with their problems and promote a better quality of life, then they're likely to be more responsible, not only responsible but for their own health, but responsible in their lives and in civil society. So proactive managing of employees' health, whether they're migrant workers or whether they are workers who are from our own country, is now beginning to happen in the United Kingdom, and they've developed a pledge. So this is the pledge of the construction industry at home, and we launched it 2 months ago at Arups, which is a huge company. As organizations working in construction or civil engineering industries, we will take action to manage the causes of occupational disease and to improve the health and well-being of people working across offices and sites, large and small. We also pledge to encourage our subcontractors and our supply chain to endorse at least one of the actions above and to implement good health and well-being activities. So I thought it was impossible to work with the construction industry, but it has been possible, and we are now hoping very much that we can improve the well-being of those in the industry. So we need to build on safety. I don't want in any way to diminish the message about safety. We need to build on health and safety regulation and enforcement and go beyond that to create a healthy, well-engaged workforce. So that was really what I wanted to say and just bring you some examples from home. Thank you very much.
Can I now invite Engineer Ho Seong Hin, the Director of Occupational Safety and Health from MOM.
Oh, thank you. That was certainly a very interesting speech, and that you know that health can also impact on construction. Maybe that's what we should start doing instead of focusing on safety in the construction sector. Well, good afternoon, ladies and gentlemen. First, let me thank the School of Soh Swee Hock School for inviting me to this panel discussion. We are indeed honored to have Dame Carol Black to share with us the UK experience and to know that things are possible, right, even in the construction industry. Now, let me start by saying one thing. The other day I was driving along the road near Shenton Way there, and there was this building, they are under construction. They have a lot of slogans out there. And one of the slogans that I saw sort of attracted my eyes. They said that things were so much simpler in the past when apples and blackberries were mere fruits, right? And now we have today's world where everything is integrated into one small little device called Apple or Blackberries, where things like voice, data, even images, photographs are all integrated as one. But as you know, they didn't happen by chance. When the voice was developed by itself, as well as data, and it takes someone to go integrate it together and to make it useful. And this is what happened in the area of safety, workplace health, and also health promotion at large, the public health. And the question is that, can they be integrated? And can they be, you look at it in a holistic manner, because there's a lot of advantage to it. And this is where the challenge lies. Now, as you all know, given the tight labor market, the aging population, and the rise in chronic diseases, there is a need for our local workforce to work longer and in a sustainable way. We need to keep our workforce safe and healthy so that we can work well beyond their 60s and even 70s. I think it must be way beyond 65. With no injury, no occupational disease, chronic stress, or even poorly managed chronic diseases. Can this be achieved in this current landscape where workplace safety is largely addressed separately with workplace health? Although we are in the same department, sometimes the way we do things, the way we see things, the way we put in place a system and structure is usually quite compartmentalized. Now, this is not to mention how we are set up in MOM, in the Ministry of Manpower, where we deal with workplace safety and health, and Ministry of Health looking at health promotion and public health, right? So there lies a challenge, how do we integrate? But it's not all lost, because today, the other day I was discussing with Z, the CEO of Health Promotion Board, that the stars are aligned. We are seeing that the need to integrate is there, and we have a common understanding. And more important also, we have our Senior Minister of State, Dr. Amy Khor, which is a Senior Minister of State of Ministry of Health, as well as a Senior Minister of State of Ministry of Manpower. And recently she led a study mission to UK and met up with Dame Carol Black and her team, as well as visited many organizations and see how safety and health promotion are integrated. Let me tell you some stories. As you know, when I first put in place the incident reporting system, combining all the injuries, and whenever people reported the incidents, it popped up on my computer to say somebody died. And this includes, all of a sudden I realized that there are a lot of workers in the security industry, that means the security guard, dying on the job as a result of heart attack. It was a surprise to me, right? Because usually we do not have this type of information. And this suddenly it popped up on the screen. And you know, they die of heart attack, and usually because of some underlying reason, health reason. They are the more senior age, 60 over years old, and usually they got no other jobs. And this type of job, security job, is a sedentary type of lifestyle, right? And with underlying causes and not addressed, things will happen. Now, question is, what if these workers were crane drivers, crane operators, or even taxi drivers, vocational drivers, right? And if they have a heart attack, it will lead to accidents. And they will lead to accidents not to themselves, to others as well. And there lies in health has impact on safety, as you have heard from Dame Carol Black. Now there's another story that this poor lifting, when you do poor lifting, right, you hurt your back, you get backache. In more serious cases, you get slip disc, like I have, right? And the slip disc, in more serious cases, will lead to paralysis. And all this is because of poor safety knowledge, poor safety awareness on how to lift, do a proper lifting. And it will result in a health problem. And health problem means people retire early from the workforce. They are unable to contribute back to the economy. And because of that, safety impact on health. I take these two cases to illustrate the impact of safety on health and health impact on safety, and how we should think of it in a holistic manner. Now, this story highlights the need for a more holistic approach to manage all workplace safety and health risks in the workplace, and the need to focus on safety as well as health in an integrated approach manner. The question is that, can this be achieved? What needs to be done before we achieve this? First, we need to change our mindset, our thinking process, that indeed they are interrelated. Indeed, we have to look at it in an integrated manner, in a holistic manner. This is important. And as you know, in workplace safety, we always talk about risk management. And risk management assessment is always addressed to physical hazard to improve safety. But can risk management to improve health as well? The answer must be yes, because risk management is also identifying what the risk profile of the workers, the health risk profile, and what's the impact, and what are the measures that can be implemented to mitigate some of this impact. So risk identification, comprehensive RA, including profile of workforce, example health screening, is also key to help to prevent accident. Risk management, job placement or job modification, ensuring that medical condition is properly treated and managed is also another aspect. To do this, we also need professionals like doctors, HR, workplace safety and health officers, safety engineers, all thinking about safety and health in an integrated manner. Now, I'm no expert in this area. My colleague here, Dr. Lee Hock Siang, is that, as well as some of my colleagues in the Ministry of Manpower. They are the expert in this area. But I have one challenge. The question is that while we can agree conceptually that workplace safety and workplace health and health promotion need to be integrated and need to be looked at it holistically, question how to do it, how do we do it? In the area of data, merging, and voice, and cameras, and images, you have a tool called a BlackBerry, and with a tool called a Apple. But in this workplace safety and health, where do we have that? So I think we are looking at a mechanism or a service that called Total Workplace Safety and Health that allow us to do that. I was sharing with the idea that what if, let's for example, in a Jurong Town Corporation or in a estate, in an industrial estate, right, where consisting of few blocks, and each of these flatted factory, they have lots of companies, small SMEs, right? But underneath one corner, there's a total workplace safety and health service provider, where workers who are sick or injured or for whatever reason, they go to this clinic and get treatment for one, but more importantly, to find out what is the cause, whether this cause is arising from the workplace, and is there a way to mitigate some of this injury or illnesses from the workplace angle. If we can do that, that whole precinct of workplaces comprising different type of companies will have that service providing. And you all know in Singapore, we like to sell our software around the world, in building industrial park all over the world, whether in Vietnam, China, India, Bangalore, right? Imagine one day when we sell all these industrial park that we develop, it comes with this service provider, workplace safety and health service provider, attached to this industrial park. That will be the real business proposition that we can have, to say that our industrial park, Singapore-built industrial park, has this extra value. Can we see that value? So on that note, I'd like to thank you for your attention. And indeed, one day we have an Apple or a BlackBerry in the workplace safety and health scenario. Thank you.
Thank you, Dame Carol and Seong Hin, for very interesting points to raise, and thank you, Kee Sing, for inviting me to give my perspectives. I would like to, as per brief by Kee Sing, react to Dame Carol's presentation. And I think she made 4 points, and I would like to address each of these points in turn from a Singapore perspective. First, Dame Carol, you talked about the salience of health issues in the workplace from the UK perspective. Second, you gave some examples of what the UK you are doing to promote workplace health for SMEs. Third, you talk about how large organizations like major corporations and also the government, especially in the NHS system, is responding as great exemplars in terms of pushing for workplace health. And finally, you talked about how workplace health being important stands in relation to workplace safety. as separate but related fields of endeavor. And I'd like to talk about each in turn, but in reverse order from Singapore's perspective. First, workplace health and workplace safety. Seong Hin, you also talked about that. The trip to the UK where MOM and MOH we went, I think was very instructive for me. It revealed a similarity in the situation between Singapore and the UK, in that workplace health versus workplace safety, and I would like to say this as wearing the hat of a health promotion board as a confessional. We are way behind in health promotion versus safety promotion. That's the reality in Singapore, and I can say with some personal authority because in my previous role, I was a member of NTUC, the trade unions in Singapore. I was in that team that was pushing on workplace safety. I happened to run one of the largest, if not the largest, safety or education organization in Singapore. And I would say that the safety system, through the good work of Ministry of Manpower and the Workplace Safety and Health Council, has over the years developed into something quite beyond my personal expectation to be a highly valued part of the corporate landscape in Singapore. Employers take you seriously, see safety as an integral part of their work. But more importantly, we have grown a strong industry of safety experts, both within companies and as an independent industry that is able to support the very important work that companies take to improve the safety culture and practice in these companies. And I think this is something that has been a great source of strength, and that is something that we do not see as much in the health promotion field. We are, in that sense, many years behind the safety field, because whilst we do have a small cluster of people that are working out there trying to assist companies to get better in how they can promote the health of their workers, the sophistication, skill sets, and more importantly, the size of this group that is assisting companies is nowhere near what we see in the safety sector. And my observation in the UK is a very similar situation. I think there are many historical reasons why this is so. And to me, this presents an opportunity along two fronts. First, I think it should not be the policy of this government to replace the expertise that we have accreted in the safety sector with an independent group of people that are promoting health in the healthcare health promotion field. Rather, we should see how we can synergize with this already existing capability, the existing networks and the deep integration that safety experts and consultants have with companies to see how we can ride on this capability to promote the health promotion agenda. Does it mean, and Seong Hin, you're absolutely right, we haven't found the source code to how to integrate the Apple with the BlackBerry, but then how do we bring in health promotion experts to work in tandem with the safety community so that they can serve the same corporations that seek both to improve the safety and the health prospects of their workforce? I think this is one direction that we need to head along, rather than, as I said, to create a separate track and try to create more work for everyone and work separately. So that's the first perspective from Singapore. I think we should seek to ride on the strengths of the safety community rather than to supplant it. Second, in reverse order, Dame Carol's point about large organizations, governments, and major corporations. Just like in the UK, in Singapore, we have many multinationals. They are, for global reasons, very often practice leaders in terms of promoting the health status of their workers. And Novartis is operating in Singapore. They work with us. We see them as exemplars in terms of health promotion. Many of you who were with us when we launched the National Healthy Lifestyle Campaign, you also saw that we highlighted Unilever and they are doing exactly the kinds of things that, for example, BT is doing for its workforce here in Singapore. And when we ask Unilever, why are you doing this? They tell us these are our global corporate values. And those of you who come from MNCs will tell you that this is a very common practice amongst leading global corporations that integrate health promotion into what they see as forward-thinking human resources practice. It is part of the value proposition that they have for their workforce. The potential lies, I think, then in, even in these groups of companies, we find that when we talk to them and we ask them, have you done enough to support your workforce? They tell us there's a lot more we can do. Our core mission is not in the health of our workers. We need advice from experts in health promotion, how we can do better. And more importantly, because Singapore is a small market, even the largest multinationals typically hire at most 1,000 to 2,000 people. They are of not that scale compared to, say, BT in the UK, where they have tens of thousands of workers. They are of not that scale where they can economically stage programs that will cater to the variety of different health needs of their workers. There is a role then for government to come, first to foster best practice and to share it among all these different companies, and second, for us to create that surrounding infrastructure of healthcare consultants, fitness trainers, etc., that will allow these companies to tap into to run their corporate programs. And for those of you who follow what we are trying to do in Mapletree Business City Health Promotion Board, we are trying to create the ecosystem in situ for these companies so that there is this infrastructure, soft as well as hard, of companies that support these multinationals in terms of, for example, doing fitness programs, in terms of running nutrition classes, in terms of mental well-being talks, also in terms of modifying the physical environment, working with landlords so that we can make it easier for people to go to exercise within business parks and so on and so forth. Really, even for these multinationals that are at the cutting edge, there is a lot of potential for us to help them do much better for their people. And so even for government, we like to pride ourselves, and of course it is very hard for me to say that we can do more, but I would lay my name on the line. Government, as an exemplar, can do a lot more to push the healthcare agenda for their workers. Just to give you a simple example, there's been constant complaints from my permanent secretary that even in Ministry of Health, when we do our events, we serve all sorts of fried food when we cater for our people. And of course, every time I show up for the event, it is my fault that I have not pushed hard enough for government to look after the health of their workers. But the point is taken, and I'm glad to announce, recently gotten our Ministry of Health HR department and their procurement side to agree. Henceforth, it will take a much more active stance down the road in terms of, for example, sourcing for refreshments, in terms of even asking for our vendors, for example, security guards, companies, and so on and so forth, that supply to us, will government pay, for example, for the health screening of the security guards and the cleaners that work in our offices? Set a good example, see how we can lead on that. And I'm glad to inform you that Ministry of Health has decided to take that step. So there's a lot more we can do. Next, I would then, again in reverse order, go to SMEs. And in Singapore, just like in the UK, the pressures that small businesses face are identical. Typically, they don't have HR departments to run health programs for them. They are struggling every month to see whether they can bring the revenue in. Health is the last issue that is in their mind. What can we do in Singapore then to address the needs of SMEs? I've alluded to the Ministry of Health. We were going to, for example, take this step to be an example to other major government organizations to say, we will not just look after our staff, but we will also look after the contractors that work with us. That is one major initiative that we hope that if we can spread this practice, will benefit the workforce that are supporting SMEs that are vendors to major government organizations. Because if you as a buyer say that, well, I want to take care of the staff of the vendors who serve me and see them as my staff, you can get through this hurdle of having poor capabilities within these vendors. And I think the productivity gains that we have, for example, when we talk about improving our workforce, I think we should also take the perspective that people who sell to us, we should also try to improve the health and therefore the productivity of the people that serve us. And that will directly improve our productivity. So beyond the corporate social responsibility, I think there's an economic justification for that. So I think there's one perspective that we can take. The thing that is slightly different in Singapore, say compared to the UK, is, of course, those of you who are familiar with the tripartite relationship, the tight ones that we have in Singapore between union, government, and employers, is that the unions in Singapore have seen this as their role to improve, to promote productivity and the welfare of the workers in Singapore. And on that front, Ministry of Health is reaching out to the unions also to work with them to see how on a sector-by-sector basis we can use the union outreach capabilities in many of the SME sectors, for example, security guards, for example, in the construction sector, the marine, offshore marine sector, the manufacturing sector, to use their outreach to see how we can promote low-wage worker health initiatives. And on that front, I'm very glad to also announce to you that the union has come back and said that they will make this their priority next year, and we are going to have a couple of very interesting programs to see how we can improve the health of security guards, and a very interesting project in Singapore. Taxi drivers are affiliated to the union movement, and we are having a major initiative to improve health checks as well as exercise programs for taxi drivers. Those of you who are familiar with taxis know that actually this is an extremely unhealthy group that make their name very famously by knowing all the best hawker stores in Singapore. Okay. And then finally, I would end at the beginning why, and Dame Carol's point about the UK being not a very good example to us because you're the fifth most obese country. I don't know where we are on this ranking table, but all I know is Singapore is rapidly climbing up that table. And we are rapidly climbing up this table in a very important demographic. The two groups that are gaining the weight most in Singapore are the age group from 20 to 29 and from 30 to 39. In other words, the people at the very heart of your workforce. And on that note, I would just say that it is not just obesity numbers that are very, very worrying for this group, but on every other measures. These two demographic groups exercise the least, and their smoking rates are increasing the most dramatically. And if we do not target the people who are now in the workplace, the impact to this country, because of course they will be staying in your workforce beyond the age 49, at least 15 years till 65. But after they retire, the bad habits that they acquire in their workplace will stay with us, our children as taxpayers, supporting the bad habits and lifestyles of these demographic groups, us. I think I would like to end my presentation with that sobering thought. Let's do something about this. Thank you.
Perhaps while you are preparing, and when you come forward, please state your name and where you're from when you raise your questions. But perhaps before we start, maybe I could start off with a question, perhaps for Carol. there is still this mindset that workplace health promotion would be a luxury that we will, or rather will be rather sequential about it. We'll look after workplace safety, and then we'll talk about workplace health promotion or workplace health. Is that something acceptable? Realistically, I think for the men on the ground, safety issues first. Let's talk about health promotion later.
I mean, obviously you want to get to the point where you can talk about both together. But I think one of the reasons people have not wanted to talk so much about promotion and prevention because they didn't think it would meet the bottom line. You know, that was this just going to cost them money? They know they have to do safety because there is no choice. And they know what happens if they don't. But I think increasingly, and I'm sure you must have examples in Singapore, we're building up a bank of examples, both from small firms and large firms, to show what investment, and it doesn't have to be big investment, in health promotion and prevention, what it will do to the bottom line, what is the return on investment. And one of the reasons it's been difficult to get those figures is because an awful lot of organisations at home didn't keep very good data. They didn't keep very good data about even sickness absence or staff turnover. They didn't do engagement of their workforce. So, you know, relating all these things is difficult because of lack of data. And I think that's one of the reasons. So it does drag behind, I think, because safety is obligatory, but actually the economic basis, you know, can now be made. And I hope, you know, I presume you'll be able to increasingly make it in Singapore.
I think Dame Carol is right. There is a paucity of data as far as the productivity impact is concerned. I think in Singapore especially, over the last few years, I feel it should become more and more urgent for employers to start thinking about this. And I think it's to do with the change in the tone and, of course, the reality of the workforce that we're having and the easy accessibility, need I say so, to foreign workers. I think we are understanding that we are having to reduce our reliance on easy immigration coming in to solve our workplace problems. And I think what employers are starting to realize then is, I think in the past, back of a lot of employers' minds is to say that if this person's health deteriorates, I can always let the person go through whichever means, you see. Because it's always going to be easy to hire some eager beaver who's younger to replace that person. I think the reality now we are waking up to is that's not going to be possible. You know, there is a birth dearth, there's not enough young kids coming through the universities, and I think it's no longer going to be so easy to hire someone from overseas. You really have to look very hard at taking care of who you have in the workforce. And I think over time, people will start to realize that, and I think they will understand then that it is a cost to them, then that if they can't replace someone just because the person has got some conditions.
John?
Thank you very much, Dame Carol and the panelists. Again, John Wong from the National University of Singapore. Can I ask any of the speakers whether there are organizations which have decided to set aside a certain percentage of their operating budget to go into specific occupational health issues as a line item? So that's one question. And the second question is that are there specific organizations which have really decided to take on, say, the issue whereby they really want to look at what is sold, starting off with, say, food, in their various institutions? Because I think in, certainly in Singapore's hospitals, we have a high degree of outlets with processed food and fast foods, and And even in the Ministry of Health, I believe we have vending machines, which again, are there organizations which have taken on that tough step to tackle the issue of, of both food and beverages? Thank you.
Maybe there's some organization chief here that has done this about integrating their safety and health together, and also health promotion in terms of the food they supply. But I want to touch on the percentage of budget set aside. I think there are a lot of companies that do set aside budget for safety and health, occupational safety and health, and they have dedicated funds for that as well. But the trouble is that they usually ask us, what's the benchmark figure? Some say 3%, some say 5% in the construction sector, for example. But what is, my problem is that what constitutes budget dedicated to safety and health? Because if you integrate safety and health into part of your production process, and that is a necessity that you need to put in place, then it's no longer a dedicated budget for safety and health. I give you an example. You all know when you do welding, you need to take the shield to cover it and you do the welding. Is that a safety device, or is it a necessity to get you to do the work, right? This, I think most people will budget as part of the production cost because it's necessary. But you do use other type of personal protective equipment, then they will say this additional, and they put it as part of the occupational safety and health budget. So it's not very clear. My point is that it's not very clear what's set aside for occupational safety and health budget. But that itself doesn't mean that people do not put aside it. And a lot of large companies do that. I think marine sectors, construction, they do that for that purpose. So I'm not sure who wants to comment on the companies.
And I think that even if they set it aside to start with, if they really do progress, then it becomes part of the operation of the business. And I think that that's the sort of the progression you want to see. I mean, your point about hospitals, then, I mean, they're disgraceful at home. I mean, there's no other word. I mean, you go in the hospital, and first of all, they're the shops. So they're the shops, you know, that sell cakes and biscuits and soft drinks that are full of sugar. I mean, we should be ashamed of ourselves. And then there are the vending machines. And the vending machines always sell the Mars bars, the Kit Kats. And you know, you never see a healthy vending machine. But last month, the Secretary of State for Health has set up a working party to look at the food that is supplied in our hospitals in terms of its, what are we supplying both to the staff and to the and to our patients and visitors. In a few hospitals we've got to calorie labeling, but quite a lot of the really big global firms at home now, you can see exactly what you're eating, how many calories are in it, and they always, if they're really good, make the healthy option cheaper than the bad option, because I think one of the arguments was, well, healthy food is more expensive. So I think if you want to start getting a change, then if you make it cheaper, if you possibly can, of course that might mean an investment by the company, you can start. I mean, I don't see why any patient should stop smoking or not be obese if the people who look after them, for example, smoke or are obese. We're not allowed to use the word obese now. I mean, our government says that we shouldn't embarrass people by telling them they're fat or obese. Well, it's ridiculous.
To direct answer the question on food, there is one company I'm aware of that has that, and that example shows also the challenges that we face. The company is, again, Unilever, and if you visited Unilever, you know that they have an in-house little bar where they offer normal options plus a sub-part of the menu that's healthier, and they list the calories, and I think that's probably, to me, state of the practice, you know, is really like the best I've seen. Of course, the challenge is not everything is healthy, and I think that's also based on employee feedback You know, people don't want to be forced to be healthy. But I think Unilever, when you talk to them, they'll say that, look, this doesn't make any economic sense. We are just doing this as a gesture of, you know, our caring for our staff. The same reason they have, if you visited the Unilever office, they have their in-house hairdresser, they have their in-house, their in-house sort of grocery store which sells all Unilever products, you see. But it's a corporate symbol. It doesn't make economic sense because for the most part, people just either, if you're in some, you know, isolated location, you have your staff canteen, you outsource it to a big player like ISS or Sodexo, or you, if you're in business park, etc., you know, the food typically you have it with a hawker center or a food court, and you know what the issue is, you see. So I think as far as food that's being in the workplace, the solution is going to be very tough if you ask to work with companies. And for health promotion, but I think the strategy that we've been trying to pursue then is, again, using an example in Mapletree where we have a health promoting business park, is then we say, okay, no point trying to tell the companies what to do. Can we work with the food court and the restaurants that are there, you see? And actually, we have been making surprisingly good progress on that. So to just give an example, for the longest time, we always believed that white bread is totally essential for your kaya toast, you see. Okay, leave aside the fact that kaya is actually very unhealthy. But our HPB staff, and much to their credit, managed to persuade the toast box to switch the white bread to a rolled oat bread. And it was not because they did it because we're government and they wanted to please us, but they say that, look, I'm not going to work with you unless you pass the taste test, which is that the rolled oat bread must be as soft as the white bread, because Singaporeans just don't like the chewy sort of a wholemeal bread, you see. And I think we went through a lot of effort and we are able then to get them to replace, because we found a supplier that was able to have a rolled oats bread that was as soft as, you know, the normal Wonder Bread that they use, you see. And right now, I'm happy to report that they have 100% switched over to this new bread. And to them, that few cents difference doesn't make any difference, because of course they're charging a few bucks for the thing. You know, it's, this thing about cost is actually, I never believed the issue about cost. And so on and so forth. So I think the right strategy then for food is really to target the vendors, you see. I think there's a lot more that we can do to target the vendors than maybe we have done in the past. So just a little anecdote for you. The problem is the kaya, correct. We'll work on it step by step, you know.
We're going to have a healthy kaya next.
without coconut.
My name is Loh Wai Poon. I'm a social entrepreneur doing silver tours. We are doing tours, right? That means we are in the tourism industry. Our workplace is the buses, aeroplanes, hotels, restaurants, you know, and all these things. And I do not see anything that I can find in the WSHC website that concern with what is considered safety driving, for instance. For instance, no, some drivers are horrible. You know, some of those are coach drivers. So what is safety driving? Okay, what is called a safe hotel? For instance, let's say if I want to visit a new hotel or new resort, what is considered safety? What is safe? So I mean, is it because based on experience we need some guidelines, right? Because because we are dealing with human beings, and the problem is dealing with like abusive passengers, all right? All these things, how are we going to deal with it? This is also safety issue, you know, because some people get drunk and they want to hum you. And then I mean, like what caused the riot in Little India? So how do we tell our workers how to handle all these things? Is there any guidelines? Can anybody write any guidelines so that the tourism industry can help themselves? Thank you.
Thank you. Seung-Yin?
Looks like we got work for the council now. I think indeed there are different type of industry, and different industry will meet up with different sort of hazards and risks. And one area, as you point out, is the tour industry, which are in a way meeting all kinds of issues. And that's the reason why when we moved the Workplace Safety and Health Act, we decided not to be prescriptive about what every piece of work, what does the law say. And we moved towards a more performance-based and hinge upon the concept of risk assessment. And for you, for example, in your industry, if you meet up, you recognize abusive customers as one of the risks. The question is that then how do you manage the risk together with your employee? For example, training them how to deal with abusive, and what are the mitigating measures they can take in the event they meet one. Another area is driving. Driving is a huge area of work that we are currently looking into it. In the past, we have not been looking at the issue of driving because thinking that driving in Singapore especially is in the area of LTA and traffic police, right? Now, but increasingly, we recognize that management has a role to play to how do you manage your drivers in such a way they can do it safely. And this is why we are now actively participating in a work group set up by Ministry of Home Affairs, chaired by Masagos, and that we want to see how we can influence management to create a system that can manage it. One area is, for example, drivers tend to speed. The question is why? Because they are paid by per trip. If they are paid by per trip, then obviously they will speed. But the question is that, do we then put out a code of practice or guideline to say, no, you cannot pay by per trip, you must pay by per month? That's also not correct because businesses will work the way that we want it, as you say, to find a way for businesses. But the point is to recognize that paying by per trip create a risk of drivers speeding. Then what measures have you put in place to ensure that this risk can be mitigated or managed? So this is what we are looking at. Of course, we can put up some guidelines together with the industry, working together with the council, to see how tour operators, especially when they're posted overseas and stay in the hotels, how do you look out for some of the danger and some of the risks, and what are the things they can do, right? I know of people that go to overseas for posting and stay in hotels. The first thing they do is to look out where are the fire exits, right? And then whether some of these exits are blocked or not in the first place. And we have people doing that. And of course, we can work together, as I say, we'll come up with some guidelines that can help the industry to do better. Thank you for the question. This is an interesting perspective. Thank you.
Maybe I have a question for Carol in relation to leadership. Just using yourself as an example, you are a clinician, not in the area of occupational safety and health. What made you took on this role? And what were the kind of challenges that you face taking on this role? Coming into an area that is traditionally occupational safety and health.
Thank you. Well, I got interested in the role when I was president of the Royal College of Physicians. One of the faculties of the college was the Faculty of Occupational Medicine, and they have a big annual lecture, and they asked me to do the lecture, and the title they gave me was, "What is the role of the physician in supporting occupational medicine and health?" Well, it was a really difficult thing because I, as a rheumatologist, didn't know how to answer that question. And when I looked to see what did we do to support people staying in work as physicians in all the other specialties, I realized we did nothing. So I went to my rheumatology clinic. If somebody was in work, I always took an environmental history because they might be in an environment that would damage them. And I'd been taught to do that. If they said, "I'm not working," I did nothing. I never asked, "Would you like to work?" I never asked, why are you not at work? And I never said, what can I do to help you? I never saw work as a social determinant of health. I never saw my responsibility as returning someone to their functional capacity. So I think I was a pretty bad doctor. I mean, because I dealt with their diagnosis and their treatment, but I never put them back into society. And so I started to think about this while I was president of the college. As I was leaving that job, the Department of Work and Pensions and Department of Health decided they needed a national director for a 5-year program of health and work. And they did not want an occupational health physician. They wanted someone with no vested interest. And they wanted someone who the profession respected. And so they asked me if I would apply. I think there were several people applied. Anyway, they chose me. I got the job. What were the challenges? Well, I didn't know much about occupational health. I had to learn a lot. And would they accept me because I wasn't an occupational health physician? I knew really very little about business. And that was the biggest learning curve. And I stopped talking about persuading businesses to be nice and, you know, do this because it was good. You know, it helped to help the employees. I just learned to behave as if this needed the business case. So that was a huge learning curve. When I started the job, the trade unions disliked me intensely because they thought I was trying to make people go back to work who weren't fit to go back to work, which was not what I was trying to do. I was trying to keep people in employment and healthy. So there were several groups of stakeholders who I needed to win over. And then, of course, there was government, and that's a different story. But it was a matter of really getting them on my side. And I've loved the job because I realized, really, when I was a rheumatologist, I was quite narrow. Whichever specialty of medicine you choose, you're narrow because you have to be. And I've also realized that the social determinants of health, whether you get education, whether you live in decent housing, whether you've got transport, what happens to you in your early years, whether you are employed or unemployed is what really influences your health. And whether you've got diabetes is important, but not as important as some of those other things. So it's been a journey. So I've come almost to be a public health physician.
Thank you very much. My name is Che Hoon. I'm a psychiatrist, and I can't help but to thank you for bringing out that important message about mental health. I have a question for the panel. It's about our provisions for mental health as a well-being in all the corporates as well as our Ministry of Health. Because we know that mental health has been a long time as a stigma. When someone says, I go and see a psychiatrist, it is never a pleasant thing. When I see my patients walking, the patient can say hi to me because who is the doctor? It's a psychiatrist. But it's different from this, my orthopedic surgeon, because it's a different thing. So what are the things? Because we know very well that depression and stress worsen diabetes. And we know that many people who smoke, I interview many people who smoke, it is related to stress. In their break, they prefer to light a cigarette. They say cigarette is my best friend. When I'm stressed, I smoke. When I'm happy, I smoke. So how do we implement this, reducing the stigma as what Dame Carol Black say a very important thing. Instead of saying mental health, we have physical health. How do we have that kind of thing in the ministry? Thank you.
I think first of all, you've got in any organisation to have the top of the house able to talk about mental health. It's got to come right from the top and from top management that they can actually talk about it. And if you can't use the word mental health, because some people are uncomfortable, I mean, some companies prefer to talk about resilience. Some people prefer to talk about well-being. I don't think it matters which word you use, and you could use whichever word you're most comfortable with. But it is about ensuring that people do not live in a state of anxiety, stress, and mild depression, and that you train your line managers. I think this is crucial, to recognize, we don't want them to be psychiatrists or mental health workers, but are they able to be empathetic with employees? Can they recognize that people are not behaving as they normally do? Do they see that they've got a less than happy workforce? Because I think, not talking about severe mental ill health, you need to get the right atmosphere from the top. And then I think you need proactive programs. So some of the best companies have online programs to test your resilience. So I did one of the programs of EDF Energy. You could do it online. You could see where you were less strong, where you were okay, and the areas you were less strong, they taught you sort of how to cope with that. So I think there are lots of proactive things, and there's a thing that's an international movement, I don't know whether you have it in Singapore, called mental health first aid. And I think mental health first aid is an excellent thing because you train other workers to help their colleagues and to recognize stress. And I think when you start to do those things, you start to take the stigma away, because we all get stressed, we all get anxious, and we all at times probably get some level of depression. So I think it's when you can start to talk about it and normalize it, and when employers make it quite clear that it will not affect your career progression, because that's what people fear. They fear to lose their job, I think, or they fear it'll have an effect. And we've had quite a few campaigns at home, anti-stigma campaigns, which the government have supported along with the big charities.
So tomorrow I won't say that I'm going to see my psychiatrist. I'll be saying that I'm going to see my resilience physician. Mr. Lee here.
So thank you to the panel, and in particular to Dame Carol Black. I think you've exemplified how you can make the journey from a functional discipline into a sort of domain knowledge area on the subject of health and safety at the workplace. As many of you know, the Workplace and Health Council, which I chair, was set up really to try and get businesses and companies on board. And the issue with this community, of course, is that their domain knowledge is not naturally, for some of them, in the field of workplace safety and health. And so we've made it over time our duty to make clear that it's their responsibility to have knowledge about the equipment that they use, the materials that they use, the processes that they employ, and so on. Now we also want to make them responsible to think about the health characteristics of the environment, so food, work schedules, stress, and so on, and also perhaps of the medical backgrounds of their staff. This presents certain problems. Could you share with us what is the example in the United Kingdom of how employers have been brought on board to understand, to develop that sort of domain knowledge, whether it's within the company or perhaps with the help of agencies like HPB, particularly on the non-sensitive data, so diet and so on. And then how has it been taken for the more sensitive data, which is the medical histories and records of staff?
Thank you. If I deal with the more sensitive data first, it's very interesting that one of the things that employees have valued most in many companies, and this is true when it's been used in the public sector, as long as it is done properly and confidentially, has been a health check. That has been almost unanimously received well because they think their employer cares about them. So it's usually been a cardiovascular health check, so quite a simple health check that looks to blood pressure, to cholesterol, to the risk for diabetes. And of course, it is entirely private to the employee. And what the big worry is, you don't know whether they will act on it. But in our system, they would be given it absolutely privately, but it always is accompanied by, please will you go to your GP? Please will you take this to your family doctor? And because you have, you know, some risk factors now that are abnormal, occasionally people find something that's so awful that they do intervene and say, please will you go to the hospital today? I mean, you know, occasionally. But I think if you do these things sensitively, of course it's voluntary. It's voluntary. And if you can get a few people to go to the place where the health check is happening, other workers want to go. I mean, once you get to a tipping point, particularly for the lower level, the lower socioeconomic classes, they're frightened. They don't really want to find out whether their blood pressure is normal. But I think there is a tipping point when they will go. So I think it's the way you handle it and what you try and help them do with the information. Of course, you could then say, well, we will offer it again in a year's time or 2 years' time. What you will never know is, the worker will know, but you will not know, are they better or worse? But I think most people will go once they see it. I think once they see their figures, they will act on them. So I think there are ways of dealing with sensitive things. I think if you want people to exercise more, you've got to make it fun. You've got to make it a competition. You know, it's no use telling them they're obese and, by the way, will they not eat the chips? I think everything, if you're going to do these things, you've got to make it seem as much fun as you can do and combine as many workers as possible. I think, again, for the very best companies, they do see it as part of their corporate social responsibility. So they're going to do it anyway. They know it's going to cost them some money. And I know I talked to BT about what was it costing them. They said, well, actually, we should be doing it, and we're going to do it. But then they calculated their returns, and the returns were perfectly adequate. I think you've got to really appeal at a level of, if you do this, it's the bottom line, it's a healthier worker for longer who really will be safer. And I think it's that linking, which Mr. Z brought out, between the safety element and this relationship of that to a healthy person, which we tend not to bring out. But it really is there. So if you want, and if you're in an at-risk industry, then you ought to jolly well be concerned. You know, I don't want a train driver driving me from London to Edinburgh who is morbidly obese, because he might go to sleep. You know, he might get sleep apnea. So, do you know that there are, and do I want a crane driver going up a crane who's now overweight? You know, I think it becomes a safety issue for a lot of industries, and therefore, you know, stress is a safety issue in a way for the teaching profession at home. We lose so many teachers in their early 50s. They leave teaching because they say they can't take the strain. Now, I see that as almost a safety issue. So we lose them, they retire, then they go and do something else. And I think one's got to start to see these things in a way as much more, in the broadest sense of the word, as a safety issue.
Mr. Lee, you sort of asked for an example of company, and I can give you one. I was attending a health day at Roche, and I was talking to then the health committee and said, so do you have, how do you work with your safety people? Then they look at me, no, we are the safety people. Oh, you mean it's the same team? Yes. They say, oh, how do you decide to have this health and safety people in the same committee? And look at me very puzzled and said, we've always been integrated. You mean in other organizations, these are run separately? And I think that to me showed that very much the distinction that we now draw is just a mental distinction, and I think on the ground there is no differentiation. It is only the way you see matters, as Dame Carol said. If you see this as integrated, it will be integrated. And the specific expertise, as far as most common conditions that affect the workforce, it's not really rocket science. It's not some arcane thing, right? It's just getting people to eat better and exercise more, and try to have a less stressful environment. And it's something that most safety committees, if you tell them about these things, they will know what to do. Exactly. So it's not rocket science. And when I asked the boss of the Roche CEO in Singapore, I said, so is this separate? He said that, again, he gave me that puzzled look and said, in the entire pharmaceuticals industry, the safety and health people are the same bunch. So I think I say this to show the path forward and to show that actually it can be done. It is, the hurdles are not insurmountable.
Well, it's getting late. Okay. Well,
hi, good afternoon. Thank you for your talk and informative session. My name is Grace, and I'm from Ipsos Business Consulting. I have been in consultation with Prof. Chia, the WSH Council, etc., on a research piece that we're doing about the workplace health programs in Singapore. So my question is, there seems to be some discussion on how safety officers can play the role of workplace health promoters. But in Singapore, where we have a large service-driven industry, how do we create a similar structure to promote workplace health which is similar to those safety officers in the heavy industries? Thank you.
From the service industry. The safety officers, the workplace safety and health officers, we call them actually, they're supposed to look at safety and health integrated manner. But unfortunately, the whole thing was developed during the industrial development that Singapore faced. And most safety and health officers were taught basically on safety issues. And when it comes to health, they're not inside there at all. That's the reason why we say that we need to do something about it. And this is the current state. So I got no answer for you in terms of today's context, other than to say, I think we need to integrate. I think we need to go address it in a more holistic manner. Safety and health has the impact on each other. But the question is how? How can it be done? And how every single professionals, whether it be the doctors, as you say, it started from the doctors, how does a patient go and see doctors and trace him back whether has it come from a workplace issue itself, and whether safety and health officers at the ground see the things from a health angle as well as safety. So this is something that we are still grappling with, and I have as I say, no real answer for it because I'm not in the industry. I'm some commissioner sitting up there doing what is going on. We need people from the industry to tell us, but we do know that we can do something about it, and that's why we are working together with Health Promotion Board in very close collaboration. Yung Kang, when they took over, straight away the first thing is that let's have a meeting and discuss what are the area of collaboration. And today's meeting here, this panel here, is also set up specifically to say, to commit ourselves publicly, we will collaborate. Right? And this is something that we'll work on. Maybe our chairman of the Workplace Safety and Health Council, Mr. Lee, will give you a better answer to this.
I think there are two parts to the question. One is about service industries and one is about coverage on health. I think coverage on health, we tend to have a reliance on safety officers in Singapore. In many other markets that I'm familiar with, we have hygienists. And we have hygienists in Singapore, but very few. And I think the hygienist professionalism is actually one which we need to promote. It is much closer to the health side. That's not to say that safety officers don't need to have that domain knowledge as well. I think the second part was around service industries. I think the same approach really applies, which is you do a risk assessment of the service delivery process. Risk assessment not to necessarily to the guests, although you should be doing that as well, but to the staff, right? And that actually drives the steps that you would take to mitigate either the risk to health or to safety. If a safety officer or hygienist is trained to do that, should be able to do that for the process industry or for the service industry as well as for heavy industry. I think the question really is domain knowledge. And so you must know the business that you're in to be able to assess the risks that your business creates. And at the moment, I must admit that we're still very much in the hard end of it, which is trying to get the businesses to understand the risks that they create by virtue of doing their business. But they're not very good yet at understanding the risks they create by serving food and so on.
Okay, let me just perhaps ask Carol one final question. You have been very intimately involved with us in Singapore, in this journey. So what would you advise for us in terms of what's the next step following this?
Ooh, what a difficult question. I think one of the great things about seeing you see it from the inside, I of course see it from the outside. And I think you've come a fantastically long way, because when I first started to talk to you about it, I probably was just talking to you. And there wasn't the Health Promotion Board, there wasn't the Department of Health. There were, I see that you actually now doing what you had to do before you could progress, which is really get together. So I think cross departments, cross organizations, I think you've been breaking down the barriers, looking very carefully and very sensibly at what other people have done. And you've been extracting information and saying, is it relevant to Singapore? Can we adapt it, or do we need to create something for ourselves? So I actually think you've now done your homework. You've been away, you've been abroad, you've looked at things here, you've got very good examples in your global companies that are here. So I think you're probably ready, very ready, to do the next step, and that you've got enough information, and I hope enough confidence to go on and do it. So I think you've come a long way, and I would just say, because you're geographically a nice compact country, you're not too big a population, you can go ahead and do it. So when I come back next, I expect to see progress.
Thank you. So with that, thank you very much for attending, and I'd like to thank our panel members for sharing with us.